as I began my medical studies, quickly realized that, I was somebody who wanted to make an impact right away. Surgery is one of the best ways that you can make an impact directly on a patient. You can see the results of what you've done, specifically orthopedic surgery. You can take a broken bone, fix that, and get a patient standing up right away. I do mostly hip and knee replacements, and you can take a patient who's got significant severe arthritis, who's been debilitated using a cane or a walker for months, even years, and you can replace that joint and you can get them walking that day. You can get them doing stairs that day. The pain they had before is immediately gone, and you can see the joy on their face right away, and you've made a difference in that person's life to improve their quality of life, to improve their function, to take away their pain. And so working with my hands and being able to make that difference immediately was one of the reasons why I chose surgery, and specifically orthopedics.